I'm gonna hide my lamp there.
It creates an aesthetic, the lamp. You should keep it in there.
All right, we're live. And so good afternoon, everyone. We are all set for the live broadcast stream of today's Health and Human Service Committee meeting at 6 p.m. on HPA-TV, Comcast, and Frontier Government Channels 96 and 6032. It would also be streamed via HPA-TV.org, the HPA-TV Facebook page, and HPA-TV's Roku TV, Apple TV, and Amazon TV apps. It would also be rebroadcast and made available on the HPA-TV YouTube channel. So thank you everyone for attending today. I'll introduce folks according to the tiles that are in the order that I see them. So first we have Lydia Colon, who runs my office at City Hall. We have Councilwoman Rossetti, who is a voting member of Health and Human Services. We have a newly appointed councilman, Amilcar Hernandez. So Mr. Councilman Hernandez, are you a voting member or you are a voting member of Health and Human Services? Okay, wonderful. Well, welcome. We're glad to have you. And now we have director. Is it interim director? Mrs. Shapiro? Yes.
Interim assistant director.
Interim assistant director, Ms. Carmen Shapiro. And we have attorney Osborne, Damar Osborne from our corporation counsel. So thank everyone for attending today. Our first item is item 2.1, which is Mayor Bronin with the accompanying resolution to accept a grant of $1,376,000 and $327 from the Connecticut Department of Public Health for HIV, HCV, and STI prevention services. So Assistant Director Chaparro, the floor is yours.
Great, thank you, Councilman Holden. And thank you all for joining us today. So this particular grant was submitted a few weeks ago. So we have not yet been granted these funds. So it was submitted along with 6 community partners that serve our local TGA. As you are all aware, we currently have 3 grants that support HIV, HCV, and STI work. We have the Ryan White Part A grant, we have a Ryan White Part B grant, and we have a 2IS grant that helps us expand on those services. So this particular grant submitted through the state DPH department in conjunction with AIDS Connecticut, Community Health Center, Inc., Connecticut Harm Reduction Alliance, Hartford Gay and Lesbian Collective, Latino Community Services, and Yukon Connecticut Children Specialty Group. So the work on this grant will, and those partners are currently, working with us in one or all of our current grants that we do. They're poised to do great work in the community. They provide services to people who are living with or at risk for contracting HIV and STIs in our community. So we're looking to, continue our work to virally suppress to viral suppression, to connect people to care, to offer PrEP, which is something that we want to do much more of because currently we're not really funded for prevention services. So this grant is really going to help us to do a lot more, to really cast the net in our TGA and really support individuals who are at risk of contracting HIV, HCV, or STIs. The total amount that we asked for was for the 1.376 million. That basically will be budgeted out to those community partners that we that I just listed, along with, I believe, 2.5 positions or 1.5, I think 1.5 positions here at HHS. So manager to help manage the entire grant. And then I believe we put part of our senior project manager's position in there as well. And then we'll have, we have our individual that does data that's already here being funded through other sources that will be, that will help manage the data on this as well.
Very closely with manual leader with the administration. I understand.
Thank you, Assistant Director Chaparro. I also want to introduce my council colleague, Majority Leader Clark, who is a voting member. So, Assistant Director Chaparro, before I ask questions, so we didn't receive this grant yet, or we weren't awarded this grant yet?
Not yet. And so that's when we submitted our paperwork, it was the draft resolution that we drafted was to apply for and accept, which is typically the way that we submit our resolutions. We've historically done it that way because it, as you know, it can be a little bit slow going to get staff on board, to get partner contracts out. And so by applying, by putting in a resolution that allows us to apply for the funds and accept them should we get granted those funds, it sort of saves us a big step if we do get funded. And the majority of the grants that we're seeing, and we've submitted 10 grants in the last 10 weeks. So majority of those grants are saying that we need to have these projects set up within 30 days. And so when we submit our resolutions, that's really why we do that, so that we can get the ball rolling immediately. Somewhere along the line, the apply for piece got taken out of our proposed resolution. So right now we applied for these funds and we were asking to apply for, and should we be granted accept these funds. I guess the good thing for this particular pot of funding is that we'll know early fall, like August, September, whether or not we'll be funded, but the start of the project will not be until next January 1st, I believe. So we'll have a good amount of time in between learning whether we get funded or not and the actual start of the project, which is really unusual, actually.
Yeah, I mean, I love this process. I think it's great to be ahead of time. So, part of the checklist. The only question I have, what if we don't get awarded this full amount? Would another resolution have to come before the council?
Yeah, I think we would have to submit, and because we have to submit the resolution with our budget that we have set up. So
That's set up. Okay. So this isn't a catch-all. So if the amount changes, then we would have to do this.
We'd have to go back.
All right. Fantastic. All right. So I'll open up the floor to my council colleagues. Any questions?
Mr. Chair.
Yes, Majority Leader.
Yeah, yes, through you. Thank you, Carmen, for your information. Question, do you have the list of partners regarding this grant? Are you able to share that with us?
Yes, I do. Do you want me to read them off, Councilman, or would you like me to send those to you?
You can read them all.
Okay, so it's AIDS Connecticut, Community Health Center, Inc., Connecticut Harm Reduction Alliance, Hartford Gay and Lesbian Collective, Latino Community Services, and Yukon and Connecticut Children's Community Expansion.
Okay, thank you.
Thank you.
Through you, Mr. Chair.
Yes, Councilwoman Rossetti.
I think, for me, I really don't require questions. I do appreciate the being, overly prepared, doing it ahead of time. I really appreciate that because oftentimes we're, being encouraged to do something that's going to happen like tomorrow. So really appreciate. And if we have to have another resolution or amend it or whatever, I'd rather that we're doing it this way. So thank you. Thank you, Carmen.
Yes.
Oh, thank you, Councilman.
Councilman Hernandez, I believe you had your hand up.
Yeah, Carmen, so question, is there a budget for this? This is a 5-year grant. Is there a budget that was submitted to the committee, or I'm new, so I don't know if it was submitted, before my time. Because it's about $275,000 per year. So I wanted to see how it kind of spreads out, especially now that we know the partners that will be involved. just to kind of like get an idea of how the money will be allocated.
So there is a budget that goes in. It's a recommended budget that we submit. I have to tell you guys, this was probably one of my most favorite grant writing processes because the partners are really involved in actually writing the grant. So we have the grant writer, we have our staff that's currently, monitoring and overseeing so much of this work. And then we had the community partners at the table. So each community partner submitted a proposed budget. We submitted our proposed budget for HHS, and then we, combined all those. We cut where we felt we needed to cut, and just trimmed and pared it, and then submitted that budget with our application to the state. So the state could, they could fund us the entire amount that we requested. They can fund us less, or they could fund us more. In any case, they'll help us work through a final budget come, should we get awarded. So they might come back with recommendations for us as to how we should, may perhaps rethink our budget. That's kind of the process with the majority of our grants. They'll say, maybe consider putting more money towards this activity or action versus here. So it just depends on who the agency that we're working with is, and we'll find out, like I said, if and when we like to say when we get funded, we'll work through that with our funding sources and finalize the budget at that point.
All right. So thank you, and seeing no, Councilman Hernandez, did you have another question?
No, I'm good. Thank you. I'm good.
All right. So with that being said, I take the chair entertain a motion.
I motion to send this back favorably to council.
Second.
Motion has been made and properly second. Any discussions? Seeing none, all in favor, say aye.
Aye.
All right.
Aye.
Let the vote show that this was unanimously favored to be sent back to council.
Great.
Councilwoman Rossetti, you're on mute.
Oh, I wasn't talking to you, sorry.
Okay, all right, okay.
That's why I was on mute. I was
Okay.
asking Greg a question.
All right, okay.
Sorry.
All right, we'll move on to item number 2.2. Mayor Bronin with the company resolution authorizing the city to accept a grant of $90,000 through its Department of Health and Human Services for a homeless prevention coordinator from the North Central Area Agency on Aging. Assistant Director, the floor is yours.
Great, thank you. So this is a similar scenario. This was submitted with a resolution to asking to apply for and accept the funds should we be funded. So this went in about a month ago to the NCAA, and it will go into effect if we do get funded on October 1st. So the premise on this particular grant is right now we actually were funded for an NCAA grant to do work with Journey Home, who then funnels funds to Hands on Hartford for us so that basically we can get our data. And the data that we're really looking for is for seniors who are struggling with or on the verge of potential homelessness. This $90,000 proposal is to hire someone for Journey Home who will serve as a caseworker for individuals who are 60 and older in our community who are facing potential homelessness, who might have gotten an eviction notice, who might be, unwelcome in their current space and being asked to move out. Anyone who's sort of on the verge of losing their home. So this case manager will help this population of individuals, will help educate them, will help refer them to services, and hopefully avoid homelessness for this population.
All right, thank you for that. I'll open up the floor to my council colleagues.
What is the age bracket here for the seniors?
So it's 60 and older.
Thank you.
Yeah. And what we're finding is that we're seeing that demographic show up in our homeless data more frequently than we want it to. So really trying to address that.
Yes, Councilwoman Rossetti?
Carmen, do you know, is there a focus on individuals or families? What are you seeing as the focus, do you think?
I believe that this will be on the focus is on individuals. I think that, of course, Councilwoman Rossetti, you know how we do our work. I think that if a family, as long as the head of household is within that demographic, I think that we'll be okay. But we're really looking at, you know, that older population, keeping them out of the shelters and off the streets, really.
Yeah, through you, Mr. Chair. Again, because, you know, thinking of certainly that age group, which, you know, unfortunately, I, you know, see that age group quite a bit at the Open Hearth. But also the concern would be to address it early on because it would be very hard to keep couples together. That would be, you know, the part that we wouldn't want to have to get to because that is not, you know, something to have easy access to. So I appreciate this, you know, initiative to, you know, we always want to have diversion be the first, you know, and even pre-diversion, so to speak. So I appreciate that. And I don't mean to call you so informally, Carmen, excuse me.
No, I don't mind.
Acting Assistant Director.
By the time I get used to that, it'll be time for me to not act anymore. So.
All right, Majority Leader, do you have any questions?
Yes, thank you, Mr. Chair, through you. Is this information, since it's targeted to seniors, is there anything that like the social workers at our senior centers are looking out for, or do they have information at their disposal that they can provide our seniors with if they're facing this issue?
Yeah, you know, the senior centers are really this amazing space where their seniors can go and really be nurtured and taken care of. And the staff is really aware of individual situations with their clients. So there is, you know, with them, there is already an existing space where they can refer folks out. If they're struggling with something that they can't really figure out, they would, you know, reach out to us. But thankfully, all of our senior centers are also operated through really, you know, proficient community-based agencies who have, you know, a lot of great resources and referral systems. So they do not only just utilize each other and the agencies in that senior center cohort, but they also are very well aware of other services within the community that can support their seniors' needs. This particular, you bring up a good point because there are a couple things that, you know, we want to put more of a focus on. So legal aid for seniors, for instance, is something that they do have access to. So we're trying to get our senior centers to help promote that more, getting affairs in order, getting their wills in place, that sort of stuff, and using legal aid to do that. And then, you know, if we get funded, these funds, which I'm hopeful that we will, NCAA seems to like this model. So, you know, we're really keeping our fingers crossed for it. It would be an education piece, making sure that the senior centers would know who to contact if they had a senior that came to them, you know, with this particular situation. So we do at all, you know, the best that we can with making sure that, you know, if there are new services that are coming into play or different agencies coming into play that can support a senior in a senior center, that the staff there is well aware.
Okay, thank you. I appreciate that.
All right. Seeing no more questions, the chair will entertain a motion.
Motion for favorable recommendation back to council.
Second.
All right. The resolution has been favored and seconded. Any discussions? All right, seeing none, all in favor say aye.
Aye.
Aye. Any opposed?
Aye.
Aye. Let the record show that the Motion has been favored and sent with approval back to council.
Thank you.
All right, and so seeing no other item on the agenda, take a motion to adjourn.
Second.
So move.
All right. And seeing no discussion, everyone enjoy their evening.
Thank you.
All right.
Everyone.